The 321 clinical trial is a randomized phase 3 clinical trial that is comparing the efficacy of Pirtobrutinib in relapsed refractory patients who have already been exposed to a BTK inhibitor, a covalent BTK inhibitor. So compared to the control arms, which consist of the association either of is a clinical choice between Idelalisib plus Rituximab or chemoimmunotherapy with Bendamustine plus Rituximab. And the trial have shown an advantage of the patients enrolled in the experimental arm, so receiving Pirtobrutinib, in terms of progression-free survival, which was the first endpoint of the study, compared to the control arm. What is interesting is that there is an advantage also, even more important advantage in terms of time to next treatment. So the progression-free survival of the experimental arm is 14 months, whereas the time to next treatment is 24 months. So especially in patients who were not previously exposed to the venetoclax treatment, obtain a 2.5 years of median time to next treatment. So the Pirtobrutinib has shown also to have a very good tolerability and safety profile. The main adverse event, treatment-emergent adverse event, were pneumonia, whereas both the bleeding events and atrial fibrillation were very low. In the experimental arm, out of 119 patients, only 3 experienced atrial fibrillation, and 2 of them already had a previous history of atrial fibrillation. So based on both the time to next treatment and progression-free survival and the good tolerability profile, Pirtobrutinib might be a very good option in patients who have already been double exposed to both BTKi and venetoclax-based treatment, who are now basically an unmet clinical need for the pathology.